Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about personal safety tips, local medical missions, and healthy aging. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. So happy to have Sergeant Mike Fisher with Metro Nashville Police Department here to talk to us about personal safety, and pretty timely with what's happened over the last couple of months in Nashville. Thanks for coming in,
Good to be here. Thank you.
Should we be alarmed? Of course you're scared when you hear news reports about these senseless assaults and murders.
Yeah, of course that's always going to have that impact on the community, that people are going to be, how tragic these events were, and people are going to be shaken up. So yeah, I mean, it's a good reminder that, we always need to be aware of what's going on around us.
Okay, we hear the reports. Mm-hmm. And it's probably accentuated even more, obviously, with Facebook, with social media,
right.
Constant posting,
mm-hmm.
and you have your neighborhood groups that put out alerts. On one hand, that is a good thing.
Right.
The awareness is a good thing.
Absolutely.
But the flip side of it, you worry about a little bit.
Yeah, so if you look at actual crime data and look at the actual numbers in terms of total Part 1 incidents that happen across the city, because every week we meet on Fridays and we go over all those numbers. So if you look at the historical data, you can see that the overall number of crimes is going down when you go years back. Yeah, I'm out of the East Precinct, and I mean, just one example, we keep setting records every year in residential burglaries. That it's every year we beat that record again in terms of it's declining. But the thing is, with the social media discussions on crime, you're right. There's this enhanced sense of awareness because everybody is talking about every single crime that happens in their neighborhood. You could get a package stolen off your front porch, and everybody knows.
Bicycle stolen, you mentioned that
exactly.
Before.
But what that also can do is create like this false sense of, because everybody knows about everything, that it's never been this bad before, and that's simply not true. Now you take a tragic event and then data is absolutely insignificant. A tragedy is just that. So the data, it really becomes irrelevant because it's going to have that impact on a community.
So what really are the most common crimes you're seeing in the city right now?
One of the issues that doesn't matter what precinct area you live in that we're all struggling with is the vehicle burglaries. Mm-hmm. Because that's just such an easy target and cars are everywhere.
And easy to prevent, right?
Yeah.
For the most part.
What's even more disconcerting for us is one of the things that we've been seeing in East Nashville alone. Since the beginning of this year, we've had over 50 firearms taken out of cars. Mm-hmm. And a lot of those vehicles were unlocked. And people have to understand that that's a crime of opportunity. A lot of times it's kids just checking car doors, and they go into a car thinking they're going to get some money, and now they've got a gun. So what opportunity do they have now in terms of what crime can they commit?
What are you telling people when you have these neighborhood association meetings, mm-hmm. and you go out and speak
Sure.
to people? Often that's part of your job, right?
Exactly.
What kind of feedback are you getting from them? I mean, if the cars are locked,
right.
that's another story.
Right.
They're not just open targets.
Right. You get a lot of frustration because a lot of times folks go, man, I swear I locked my car, but there's absolutely no evidence of it being broken into. I will throw this out because a lot of times we get this kind of pushback. Well, I saw on the internet you can get these devices that'll capture, that they can capture the signal and open your car with it. Those exist, but we have never made an arrest with somebody that had one of those on their person and never recovered one.
Really?
It's predominantly folks leaving cars unlocked. We're not seeing any evidence of anybody using some kind of device to circumvent the security features.
All right, so that's a common sense thing right there. Would you say the majority of neighborhoods that you go speak to, obviously you wouldn't be there if they didn't have some type of neighborhood watch program, but do we need a lot more of them in town? Do you think that would help prevent?
I tell you, kind of the mindset that we've got out of the East Precinct is not so much we're advocating for neighborhood watches, because I'll tell you what happens. If you have say you had a spike of vehicle burglaries in your neighborhood and everybody goes, hey, we need a neighborhood watch. And you form a group up, and then when things kind of level out or go away, so does the group. So we advocate that people establish neighborhood associations, and crime and safety is just one part of it. But then you've got overall quality of life discussions at those monthly meetings. You know, you might have Public Works there, you might have your council representative there. So we do come in and talk to them about safety or issues that we're seeing in their area, but then there's a broader picture, and that keeps those neighborhood associations kind of sustained for the long run.
All right. Lighting around your home. Let's talk about that.
Sure.
Do you think that is also a big deterrent?
Absolutely.
If there are, they used to have events, I remember, where they'd have the national leave your front porch light out
Sure.
on,
Sure.
those type of things. Does that deter crime?
I do believe so. Good lighting, making sure that your landscaping is well maintained. It doesn't get so overgrown that it gives somebody a place to hide.
Opportunity.
And we tell folks, if you've got an alarm system, put a sign out and advertise it. Put stickers on your window. If you have cameras, advertise it. Because at the end of the day, you know, criminals are pretty lazy. So if I'm walking down the street and your house is well lit and there's not a lot of places for me to hide, and there's signs for cameras, signs for alarms, but the house 2 doors down has none of that, that's an easier target for me to go after.
All right. We talked before the show started about just awareness, always being aware of your surroundings.
Right.
And you talked about you personally when
Sure.
you get off late at night, and a lot of people work odd hours.
Absolutely.
They have to go grocery shopping, or they may have to walk their dog and it's late, it's at midnight or 1 a.m. So they're going to have to be exposed to some degree.
Sure.
What do you do?
So, you know, what we want to instill in the public is, one, we don't want to make people think we're trying to make you paranoid by saying these things to you, but we definitely want people to get into the practice of having just a baseline of situational awareness, always being cognizant of what's around them. You know, one of the examples I give is when I'm coming home at night, you know, when I get a good half a dozen to 10 houses away from where I live, I want to start scanning around the neighborhood and seeing who's out and about, because you're going to recognize all your neighbors. But if somebody's out of place, or specifically if you notice somebody that appears suspicious and seem to be watching you really intently, that should set off some warning bells going, who is that and why are they paying so much attention to me? And that may make you go, maybe I shouldn't pull into my driveway just right away.
I was going to say, then what should you do?
Sure.
Don't approach them.
Right, right. You know, we want people to call us. Another reason why we kind of steer away from terms like neighborhood watch. We don't want people out patrolling their neighborhood or confronting people that are suspicious. Call the police department, let us come check it out. And if it's nothing, that's totally fine. I mean, I can't tell you how many times we've been called out for meter readers. Somebody says, hey, there's this guy in the bushes next door to my neighbor's house, and it's the person reading the meter. And that's fine. That's a good thing. We would rather go out on 20 of those than somebody be reluctant to call us when there's a problem.
All right, Sergeant Fisher, thank you so much. I know there is the non-emergency number.
Absolutely.
Let's give that test again.
862-8600.
862-8600, good number to have next
Right.
to your phone or on your person at all times. That's a good number to have handy. Thank you so much for what
Absolutely.
you do protecting us.
Oh, it's good to be here.
All right,
Thank you.
Thank you. And we'll be back with a lot more after this. When you hear of medical missions, typically you probably think about overseas missions or missions to third world countries, but it's happening right here in our own backyard. And Nancy Ennis is the Chief Advocacy Officer with St. Thomas Health, who's going to talk about these missions that have been going on now for about a decade.
Yes, yes, they have.
Appreciate you being here and the good work you're doing in Nashville for people who are either not insured or underinsured, correct?
Correct.
All right, so how did this get started?
So in 2008, myself and another director at St. Thomas Health was Amber Sims. We had done an executive spiritual formation at St. Thomas Health. We needed to have a project at the end, and I had coordinated several medical mission trips overseas and done a lot of work like that. And I said, you know, there's so many poor in our own backyard. And as a family nurse practitioner, I see it all the time. And so let's have a medical mission at home, right here in Nashville. And our first one was December 6, 2008. It was at the Holy Name Catholic Church, and we had 8 volunteers, and we saw over 100 patients in 2 hours.
Goodness. You said, you can treat somebody under a shade tree.
That's right.
You don't have to go into a doctor's office if
don't.
need be. If
Absolutely.
You can take care of them. What has the response been since that time? I would imagine it's grown and grown and grown as the awareness has grown, that
Yes.
you're there.
Yes, it's really grown. We've done, this will be our 38th medical mission at home, which will be in Nashville at the Municipal Auditorium. And we welcome anyone who is uninsured or underinsured. Please come. We provide medical services. This is all free to the public. Medical services, dental services, vision care. We have free pharmaceuticals, as you know, they're written by the physicians or the nurse practitioners. We also have screening mammograms. We will have.
Oh, really?
Yes.
So you offer that extensive of a service, preventative health.
Yes, preventative health. We also have, in addition, foot care, foot washing, and we will have digital x-rays. We'll have chest, extremities, spine x-rays on site with real-time results, and we will have ultrasounds, abdominal ultrasounds, pelvic ultrasounds, thyroid ultrasounds, anything that patients might need, we will have that on site.
What happens then, Nancy, if you do diagnose something significant in the patient? Then what kind of follow-up care can you provide?
That's a great question. Before people leave, if they don't have a primary care provider, we make sure that they are discharged with a primary care provider and a follow-up appointment. If they already have a primary care provider, we make sure they have all of that documentation that we did for that day, where there be the full lab panel, CBC, CMP, hemoglobin A1C, INRs, serum lipids, et cetera, things like that. We will make sure they have that to take back to their primary care provider and also to establish with a new primary care provider. If we find something that needs surgical intervention, which sometimes we do, we find large masses on thyroids or mass on ovaries, things like that. What we do is we make sure that they get in for follow-up, and we make sure they get in for follow-up usually at one of our St. Thomas Medical Partners physicians, surgeons, who will follow up that patient, and it will be based on their household income sliding scale.
Is this something that St. Thomas sees as part of its mission? I would imagine so.
We
obviously.
do, yes. So our mission is rooted in the loving ministry of Jesus as healer. We commit ourselves to serving all persons with special attention to those who are poor and vulnerable. And we really believe that this is just part of, really putting our words in action, providing these medical missions at home. Number 38 is so important because so many people are uninsured and underinsured.
Are you seeing a lot of elderly, more children? Who are the most vulnerable?
That's a very good question. I think we see, really the people who are 18 to 64. Because when you're, newborn to 18, you do have coverage, but, through Cover Kids and TennCare. And then predominantly if you're 65 and older, Medicare is available. So it's really that age range between 18 and 64 that we see.
And you've seen the need increase, you said, because of changes with Medicaid. Is that correct?
Yes, we've seen the need just increase. Now we see where, 10 years ago we saw, 100, little over 100 patients, our very first medical mission. Now we're expecting anywhere between 900 to 1,000 patients on September 22nd at our medical mission in Nashville. So it's just grown just exponentially. And we believe that one of those reasons is because we as a state in Tennessee, unfortunately, we did not expand Medicaid, so therefore we have over 300 Tennesseans who are uninsured.
You're doing this how often each year? Are you doing several of these missions each year?
We do 3 to 4 missions a year.
Is it hard to get enough people to staff them, to get the support at your end, the medical personnel?
You would think that,
You would think so.
but we do not have problems with volunteers. Many times we had one in Warren County July 28th, and we had over 300 volunteers. Already for this one in September 22nd, we have nearly 400 volunteers that have already signed up. So
That's incredible.
we have physicians, nurse practitioners, pharmacists, nurses, opticians. We have people from ophthalmologists. We have people from every field of
what dedication,
medicine.
What devotion and dedication.
Yes.
Boy, we're lucky to have you here. Thank you so much. And you saw the information on your screen earlier for more, medicalmissionsathome.org. And we'll be right back after this. September is National Healthy Aging Month, and our population is definitely moving in that direction, aging. In fact, they say the numbers by 2050 are going to be by 2040, that number will grow to 1 in 5 Americans over the age of 65.
Yes, indeed.
So we need to start preparing now to be healthy later. Dr. Jocelyn Burdell is my guest. Thank you so much for coming in.
Thank you for inviting me.
What are your primary goals during the month of September? What's the big message?
Sure, the big message is to be healthy. That's really important in terms of the message that we try to convey to not only our members, but just to the population in general. Social isolation is really a challenge, I think, for a lot of seniors. The National Council on Aging has reported that 1 out of 6 seniors have some type of barrier that prevents them from improving their economic security, as well as having access to some type of community engagement center. And so when you have that many people who are not being connected, that means that they're becoming depressed, they're suffering from poor health. And so we want to make sure that we can take care of those individuals and make sure they have access. And to me, that's the simple solution, is getting them out, getting them transported to centers, ensuring that they have some type of in-home care, as well as providing a series of programs and activities for them in our centers.
How do you reach those people when they are isolated? How do you get to them?
Sure. We've got programs that many, either programs and or we've got doctors, social workers who will refer them to our agency, and then we'll be in contact with them. We also know that we've got members in our centers who kind of drop off sometimes, and so we do a telephone reassurance to check up on them, see how they're doing, and seeing whether or not they need some of our other services out of our supportive care team. And so there are ways that we do that. And I think it's also family members just seeing programs like this and knowing to get their loved ones out of the home and getting them to an agency.
There is a correlation, I'm assuming, between being isolated as an elderly person, a senior person, and decline in both physical and mental health, correct?
Yes.
And again, what are some of those things that can happen? Depression, you mentioned.
Yes, depression. There's always cognitive decline, and one of the things that the researchers talk about. And so how do you stop that from advancing? And so in depression and suicide, it's really getting those individuals out of the home. If possible, or bringing them or bringing someone into the home, as we do with our supportive care team. But if they need transportation, utilizing transportation services to get them to senior centers where they can be socially engaged and they can be involved in educational programs and they can meet new people and have new friends. If I may give you an example.
Please, I was going to ask you
I
that
moved
next.
here 6 years ago and ended up moving my mother here, who at the time was 83 years old. And the first thing I did was get her connected with 50 Fort. And that was before I started working at 50 Fort, because it had such a reputation for ensuring that our seniors are well taken care of and they remain active. And for her, it was wonderful. I mean, she does yoga. She participates in one of the singing groups at one of the centers. She goes on trips, and she's met new friends. And for someone who didn't know a single soul here in Nashville, it's been really, I think, a lifeline for her.
That's a great story. I was going to ask you for other examples, and maybe have you seen her health improve? I don't know what her health was like prior to that.
My mother's health has been outstanding.
Outstanding.
And so she's definitely maintained. She just turned 88 last week, and she's still participating in all the things that I just mentioned.
Oh, that's wonderful. What are some of the other activities or educational programs that 50
Sure,
Forward
sure.
offers?
Sure. Well, we focus on health and wellness, educational programs, volunteering, and I'm going to forget one right this second, so
That's
I
all right.
apologize.
No,
but I'll
no,
remember
that's
in a minute.
plenty, yes.
But and so that could be anything. When you look at physical fitness, that could be anything from Tai Chi to Zumba, weight training, those kinds of things, depending on the center. If it's something creative, you could join a theater group, singing group. There are creative writing classes, poetry classes that they can get involved with. If they choose an educational program, we do the Aging Mastery Program, which is a evidence-based program that's done by the National Council on Aging out of Washington, D.C. And so there, it's a 10-week curriculum where they learn anything from physical fitness to navigating relationships with your family to volunteering. Financial management, they do all kinds of things in that particular course. And so we've got jewelry making, we have a laboratory program at one of our other centers. And so there
I had
are all
no
kinds of
idea.
things, that they can do. And if we don't do it, and it's something that a group of members want to be able to do, they can. At our Turner Center, they created Genealogy Club because that's what they wanted to do, and
Fascinating.
it is one of our more popular groups out there at Turner.
And one of the things I think people need to realize as people age, get older, and they retire, there can be a huge void, and they have more time than they've ever had in their lives
That's
to
right.
pursue passions.
That's right.
Like genealogy or whatever. Okay, so where are the centers located? Can you kind of give us an
Sure.
idea?
5 are in Davidson County, 2 are in Williamson County. The 2 in Williamson County are College Grove and Martin Center, which is in Brentwood. In Davidson County, we have Bordeaux Center, which is in Bordeaux, Donaldson Station. We
Okay.
also have Knowles and Turner, which is in Bellevue, and then we have.
Oh, that's okay. We got the website. That's a
Okay,
lot to
awesome.
remember. No,
Awesome.
50forward.org. For those of you who have got a computer handy, 50forward.org will give you the rundown, the list. I know I've been by the Martin Center many times on my way to Williamson Rec Center to work at, and it's a lovely facility.
It is.
I was in there to speak once. So 50forward.org, and we appreciate everything you're doing. I mean, this is so wonderful. I've learned a lot today about all the programs, and glad your mother's doing so well.
Thank you.
At the young age of 88.
That's right.
It is just a
Thank
number,
you.
truly.
Yeah.
Thank you so
Thank you.
much. Thank you for watching Community Health Matters. You can learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.